Assalamualaikum everyone. I am Ariba Tariq Lutfi and welcome to Sante's weekly broadcast Nazaria, the power of experience. We were having a conversation about experiences versus knowledge with Pakistan's leading ophthalmologists and their practice in treating glaucoma, and share this knowledge with our viewers and especially the new ophthalmologists and the junior ophthalmologists. So today, I would like to introduce one of the leading ophthalmologists in Pakistan, Dr. Naveed Ahmad Qureshi. He is the consultant and professor, VitreoRetina department at Shifa Trust Eye Hospital, Rawalpindi. So, Assalamu alaikum, Professor Naveed. How are you doing?
Walaikum assalam. I'm fine, perfectly all right. आप कैसी हैं?
मैं बिल्कुल ठीक हूँ. So, Professor Naveed, since हम experience sharing की बात कर रहे हैं, तो आप कुछ नजरिया के बारे में कहना चाहेंगे experience sharing के बारे में?
It's very nice. It's a good platform for all the doctors, even for seniors as well as for the juniors as well. For senior, that we are actually sharing our experience, and for junior, they are learning from our experiences. That's a very good platform. I really appreciate it.
Thank you so much, Professor Naveed. So let's move on with the questions so that we can get to the actual gist of knowledge. So first of all, I would like to ask you, can you please explain or tell us about the prevalence of glaucoma versus diabetic retinopathy in your practice? And I would like to mention that I diabetic retinopathy के बारे में इसलिए बात कर रही हूँ because that is your frequent practice. So I want to relate both together.
Yes, that is, there is a strong relationship between diabetics and the glaucoma. If you see the general population, the average percentage of glaucoma in the general population is very high in diabetic patients. And there are many studies in it. Recently, there is a study in the Oman Journal of Ophthalmology in which there is clearly mentioned that 15% of the diabetic patients having glaucoma as well, and the mostly among majority of these patients are primary open angle glaucoma. Okay. So there is some common pathophysiology between diabetics as well as glaucoma patients. So initially it was not clear what is these pathogenesis, but now there are something which we understand that why these glaucoma patients are more common in diabetics.
Okay, diabetic retinopathy क्या risk factor है glaucoma के लिए?
Yes, that is a risk factor because there are certain common pathophysiology which operates in diabetics as well as in glaucoma, like microangiopathy, okay. Like there is some vasculopathy and neuropathy as well. So there is apoptosis, means there is plant cell death, which is more common in case of diabetics. So these patients having open angle glaucoma, they are mostly in these patients, there are low tension or normal tension glaucoma. Okay. So there is some relation between these diabetics as well as in glaucoma patients.
Okay. So it is basically a risk factor, and it is, I am sure कि ये मेरे लिए तो actually knowledge में इजाफे की बात है, और I am sure junior ophthalmologists must be interested in knowing this as well. So I would like to mention American Diabetes Association की एक studies थी, उसमें ये बात की गई थी कि glaucoma जो है वो usually पहले अकर ज़्यादा earlier अकर करता है in people जिनको जो है वो diabetes हुआ हुआ है. तो is it true? Exactly. And if there is an association, तो आप उसको थोड़ा सा elaborate करना चाहेंगे, please?
Exactly. The patient having type 2 diabetes, they are more prone to it. And along with the age, though diabetics, the age as well as the duration of the diabetes, so how long the diabetic is, that is strongly correlated with each other. So if the history of diabetes is more than 10 years, then there is a risk of glaucoma is higher in those patients. And especially type 2 diabetics are more prone to having glaucomatous. So there are certain microangiopathy happens in case of diabetes. So especially on the nerve fiber, optic nerve head, there are small vessels which are usually affected with these diabetics. With the diabetes. So there is microangiopathy, and the optic nerve head actually they're more prone to damage with the glaucoma. There is slightly increase in pressure, and they are more prone to damage in the glaucoma. So glaucoma affect early on these diabetics as compared to normal population.
Normal people. Okay. Okay, so that was interesting to know the correlation between diabetic retinopathy and glaucoma. So, what examination protocols do you suggest to the ophthalmologist should ensure when diagnosing glaucoma in the diabetic retinopathic patient?
Yeah, I will tell you. Actually, when the patient come to the retina clinic, so
Ji.
most of us are focusing on the retina, not on the disc, especially for the glaucoma point of view. So every patient come to our clinic, we should see the optic nerve head. We should check the pressure as well as we should check the angle, gonoscopy. It's very important, at least in the first follow-up, in the first visit. And the baseline investigation, this should be included this visual acuity with the optic nerve head examination, and particularly the recording of these optic nerve head with the help of this fundus imaging, as well as you can go for the OCT as well. If you have doubt, you just record the pictures of fundus and then compare it after 6 months or 1 year. So you are able to check whether this is the diabetic patient, or just you are just checking it is it diabetic or not. So it's very important to investigate thoroughly in these kind of patients.
We are talking about examination protocols. There's also another thing or another aspect of this, the treatment of choice and the medication. So what is your treatment of choice in terms of medications in glaucoma management, considering the international protocols as well, when you're treating the glaucoma patients actually?
Right. I will tell you, I'm adding one thing in it. There is another type of glaucoma in diabetic. It's called universal glaucoma. So this is another entity. It happens in advanced. It's called ADED, advanced diabetic eye disease, which happen in that case. When there is end-stage diabetic retinopathy or advanced stage diabetic retinopathy, there is called universal glaucoma. When there is universal on the iris and as in the angle, so in that case, the pressure rises. This is called secondary or universal glaucoma. So we must check these kind of glaucoma as well. In spite of primary open glaucoma in advanced diabetics, there is possibility of neovascular glaucoma even in the absence of diabetic retinopathy.
Okay.
We see some patient with no retinopathy, and there is advanced neovascular glaucoma as well.
Okay.
So there are different treatment for primary open angle glaucoma, even in diabetics and non-diabetics. The treatment of choice is fixed combination. It depends which stage patient come and what is the primary intraocular pressure. So my preference is the fixed combination. Darzolomide timolol is my the initial drug of choice. And if pressure is not controlled, then add another drug like prostaglandin as well. So in my specialty, we are this is safe as well, because there is no chance of inflammation. In the inflammatory conditions, we cannot prescribe these prostaglandin. So we can easily prescribe post-operatively as well as in other primary open angle glaucoma cases. So my preference is the fixed combination.
Okay. So thank you for your input on so many things, as well as your protocols, your treatment of choice, and also telling us the correlation between diabetic retinopathy and glaucoma. So lastly, I would just like to ask you if you have any take-home message or advice for the junior ophthalmologists who are watching you today.
Okay, briefly, I will tell you, all the junior ophthalmologists as well as senior. So any patient with diabetic retinopathy, you must examine the optic nerve head, intraocular pressure, angle. This is must. And as angle, I am emphasizing because there are some new vessel on the angle before appearing on the iris. So if you see the new vessel on the angle, you can save that eye, because at that time, if his pressure is not raised, you can save that eye. So the treatment of that kind of cases is you have to do properly thorough laser PRP. The treatment of choice is pan-retinal photocoagulation. With this pan-retinal photocoagulation, 1 or 2 sessions, these new vessel regresses and you can save that eye. So before going to waiting that pressure is raised, we should go for the PRP. And the other thing is examine the patient as well as investigate, and record keeping is very important. So you must write down the intraocular pressure and write down the time, at which time to examine the patient, and then at the follow-up examination, compare it. So it is very important for the diabetic patient as well as properly take history, examination, and give your proper treatment. So pressure checking is the must in all diabetic patients.
Okay, thank you so much, Professor Naveed. This has been such a enlightening session for me, and it has been a new session for me as well. Because आपने जो हमारे साथ share किया है और junior ophthalmologist के साथ share किया है, it must be very valuable, and it is valuable for us as well. And I'm sure कि जो general public भी देख रही होगी, उनको भी इससे कुछ ना कुछ जो है वो idea हुआ होगा कि किस तरह जो है वो diabetes या diabetic patients में जो है glaucoma की जो है वो incidence ज़्यादा हो जाती है और earlier हो जाती है. So thank you so much for sharing your valuable experience, and last few words just to close up the session.
A very nice session and very nice effort. And I thank you, all of you, all the Sante team, Nazaria team. They are very good initiative, and it is helping the general public as well as the doctor community, and they are contributing their part towards the education, medical education. I'm really thankful to all of you.
Thank you so much for joining us here today. It has been an honor to do this session with you. So we are going to close up, everyone, and see you in our next episode. Allah Hafiz.
Allah Hafiz.